We all struggle with feeling like there's not enough time in the day to be productive personally or professionally. We all struggle to make our time matter. It's time to take control. It's time to start investing in the corporation of you. At Athena, they've helped over 700 ambitious professionals achieve more by connecting them with best-in-class, globally remote executive assistants. Athena executive assistants go beyond basic administration tasks. They help you make time matter through the art of delegation. They believe delegation is the superpower of all highly successful people, and your personal EA will help you get there. Your EA is a one-on-one long-term partner to help you achieve your personal and professional goals. Take back your time. Join the waitlist at athenago.com. That's athenago.com.
Hi, I'm Brianna Seeley, producer for OffScrip Health. Welcome to the Heart of Healthcare. Before we get started today, I'd like to tell our listeners about another show in the OffScrip Health podcast network, Beyond the Paper Gown. Beyond the Paper Gown is candid, credible, and curated. Listen in to learn how host Dr. Mitzi Crockover can inspire, empower, and inform women with the latest information about their health and healthcare choices. Check out the latest episode, an innovator spotlight on Rosie, the sexual health app, featuring Dr. Lindsay Harper, OBGYN, founder and CEO of Rosie, an award-winning women's health technology company. Or the Sexual Health Matters episode where Dr. Mitzi Crockover and Dr. Lindsay Harper talk about common complaints and treatment options for those with sexual health concerns. For more information, visit offscrip.com/shows. The link will be in our show notes. Enjoy the show.
It is one of the most common forms of contraception people use, but birth control pills require a prescription in the U.S. Now, a pharmaceutical company has submitted an application to make birth control pills available over the counter.
Oral contraceptives have been used for over 60 years. This FDA application for the over-the-counter status followed more than 6 years of study on the ability of women to safely use this medication. In any other year, the application may have gained little attention, but this is now.
Hi, listeners, and welcome to the Heart of Healthcare podcast. I'm your host, Hallie Tecco. Today, I wanted to share something I put together for Stat News, which was published yesterday. Last week, HRA Pharma announced that it submitted the first ever application to the FDA to turn its birth control pill, which is called Opill, from a prescription to over-the-counter. If accepted, this would allow people to purchase birth control, or at least purchase this brand, without a doctor's visit, without a prescription. Just go to the pharmacy and buy it, much like you would buy any other medicine cabinet essential. And this makes a lot of sense because over the last 50 years, birth control has proven to be safe as other over-the-counter drugs, and the potential for misuse or abuse of a birth control pill is low. This is obviously a timely move with the repeal of Roe v. Wade, and if the application is approved, the U.S. would join more than 100 other countries in making over-the-counter birth control available. This concept is supported by 74% of American women, as well as by the American College of Obstetricians and Gynecologists and the American Academy of Family Physicians. A positive ruling could open the door to other brands of oral contraception and other methods of birth control to follow suit. Unintended pregnancies in the U.S. are at an all-time low, yet they still represent nearly half of all pregnancies. Brookings estimated that every unintended pregnancy costs taxpayers $9,653, and that was in 2011, so it's likely higher today. But the cost of preventing a pregnancy, it's certainly well under that number. But like most areas in healthcare, the U.S. still has not invested in preventive care. Most U.S. women of reproductive age, 65%, use contraception. Unfortunately, more than 2/3 report that the full cost of prescription contraception is always covered by health insurance or another program. But health plans are not required to cover over-the-counter medicines. So this approval could shift the cost onto those using the pill. This is why I think it's really important that any introduction of over-the-counter birth control, which I hope happens, would need to be in addition to a covered prescription option. And we should make this medication eligible for inclusion in the flexible savings accounts programs. Even better, we could accompany this by an expansion of the Affordable Care Act to cover over-the-counter birth control. Even though 9.1 million women use birth control pills, more than 19 million women of reproductive age live in so-called contraceptive deserts, with limited access to a publicly funded provider who offers contraception. And 1/3 of women at risk for unintended pregnancy who try to obtain a prescription for birth control report having had trouble doing so. So not only would an over-the-counter birth control option increase access and save time spent on travel and doctor's appointments, especially for those in rural areas with few providers, but researchers also anticipate that it would reduce unintended pregnancies by 7 to 25%. There are currently more than a dozen startups, including Pandia Health, Project Ruby, Choice, Favor, offering prescriptions to birth control virtually. But unfortunately, most don't accept insurance, and the required virtual medical consultation can cost between $15 and $59. If the prescription requirement is dropped, and I hope it is, these companies are well positioned to make obtaining the pill easier and more affordable, delivered right to your doorstep, even if it means a little less revenue for them. Preventing unintended pregnancies has become even more important now than ever, following the Supreme Court's Dobbs decision repealing Roe v. Wade. Increasing access to birth control reduces unplanned pregnancies. So why haven't we already invested in public health policies to support widespread availability? It is past time to implement reasonable measures to make birth control more obtainable, convenient, and affordable, or even free for all. If you agree, I would recommend calling your local representatives and letting them know how you feel. You can also learn more about the movement to free birth control at freethepill.org.
Thanks for listening to this episode of The Heart of Healthcare. If you like the show, be sure to subscribe, leave a review on Apple Podcasts, follow us on social, and tell all your friends to listen. The Heart of Healthcare is a product of OffScrip Health. We are a healthcare engagement company built for patients and caregivers by patients and caregivers. Our executive producers are Matthew Zachary and Andrew McDowell. Our senior producer is Brianna Seeley. Our intern is Antonella Sterniolo. Our host is Hallie Tecco. It is recorded, mixed, and edited by Brianna Seeley. For advertising and media inquiries, email media@offscrip.com. That's media@offscrip.com. For more information, visit offscrip.com.